You're listening to the Sick and Good podcast. My name is Dustin Messick, RDN. I'm a cancer survivor.
My name is Dr. Colin Goodwin, and I'm a cancer survivor. We're discussing topics related to cancer treatment and recovery while promoting wellness.
To find a balance between sick and good.
That during the cancer process, both can be true.
The Sick and Good podcast is for educational purposes only. The podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment, and before undertaking a new healthcare regimen.
All right, joining the conversation, we have Wendy Griffith. She is a licensed clinical social worker with over 15 years of healthcare experience. That includes clinical work with patients and caregivers and macro-level work involving project management and quality improvement. So welcome, Wendy.
Thanks. Excited to be here.
Wanted to ask, as we do with each guest, what kind of brought you into the cancer field?
That's actually a great question. When I was in college, one of my professors had just started at the University of Texas, and she had an expertise in pediatric oncology. And so she offered this social work in the medical setting class, which, I don't know, just had an interest into me. I had no idea sort of what environment I wanted to work in or what population I wanted to work with. And so I saw the class, I took it, and just every story she told and the way she described the work and the patients and the impact, it just always sounded amazing to me. And there were other people in class who actually always said it sounded really hard to them. And I was like, I don't get that. I mean, it does seem hard, but it just seems amazing. And I don't know, even just hearing about it sort of was enthralling to me. And so then when it came time for me to do my first internship, I ended up doing it at Scott and White up in Temple and ended up also in pediatric oncology. And so I just fell into it. And after a few weeks, I loved it and ended up never leaving. Even though in my grad school internship, I actually tried to find a different setting to work in. And then as I was applying for jobs, I tried again to do a different setting, and just all roads always led me back to oncology. And so I finally just realized it's really my passion. So it's where I've stayed.
Tried to get you out of the game, but the game still wanted you or something like that.
Yeah. I couldn't get away from it. And after a little while, I didn't want to get away from it because it was it's just so meaningful, and you get to meet like the best people, and like whether that's colleagues or patients, caregivers, doctor, like everyone was just amazing. And it was just really, I don't know, fulfilling to see the impact that you can have. So here I am 15 plus years later, still in oncology and still loving it.
Well, could you tell us about your role at MD Anderson?
Yeah, absolutely. So the role has changed a little bit over time. When I first started there, I was a social worker and I worked in the head and neck clinic directly with patients. And in that time, I was on the adult side, of course, but I had history in pediatrics. And so I was seeing a lot of patients who actually were younger and who were in their young adult phases, and a lot of older adults. But it really became clear sort of some of the gaps in care for the adolescents and young adults. And so, I did it for many years, and I think all of my team sort of knew my love and passion for the younger patients. And so I was always really involved with them, and just kind of over time continued kind of on a separate path of trying to create a young adult support group. And then I joined our young adult advisory council and eventually started leading it. And so just over the years, we were really identifying more and more sort of the gaps in care for adolescents and young adults and sort of how we could serve them better. And so across many, many years, we kept coming up with ideas for how do we have an actual program that can serve these people? How do we have a clinic? Like, what's the dream? And so with our Young Adult Advisory Council, we sort of brainstormed what this could look like and created a business plan that eventually got approved. And so once that clinic officially launched in 2018, I actually left social work, and then I came over the Adolescent and Young Adult program, where I now have the privilege of being the program manager. And honestly, what that means is that I have my hands in a lot of pots, and I do a lot of different things. And really my job is just to support the team and the people and the programs that support our patients. And so sometimes that's working within our medical record system and improving flow sheets and reporting and looking at data and numbers. Sometimes it's planning, a Saturday like we did yesterday at Cidercade and doing fun stuff and doing retreats. Sometimes it's, reviewing scholarship applications and doing quality improvement projects and trying to sort of implement new things that patients want to see in the waiting room or in the clinic process. And so I just have my hands in a lot of different pots and I get to do a lot of different things.
Yeah, it sounds like you are wearing a lot of hats and that it's very rewarding. You get to be like in management, kind of helping everybody who's there.
Yeah, absolutely. And truly the role technically is administrative, but I still really love the clinical work. So I actually still do our support group. And of course, I've been doing this for a really long time. So I know a lot of our patients personally. And so I still get that sort of patient engagement and interaction. And to me, I don't know how you can be a really good, successful administrator and build a program if you're not directly in tune and in touch with the people that you're trying to serve. And so I'm super, super lucky. And I work with a great team and we have a great leadership team within pediatrics in MD Anderson that are super supportive. And so I really get to do as much or as little of the clinical care as I want to.
I actually wanted to ask a little bit about some research that I understand you've been a part of, MD Anderson. Can you tell me a little bit about the advanced care planning research that you did?
Yeah, absolutely. So within oncology, obviously advanced care planning is a topic that has just kind of increased in popularity and awareness over the years. But I mean, it's always really important. And the truth is actually advanced care planning is something all humans should do. So whether you have cancer or any kind of illness, whether you're in your 20s or you're in your 60s, really everybody should have their advanced directive documents in place. But for the most part, it's something a lot of people don't ever think about unless they are diagnosed with some kind of serious illness. And so, of course, within oncology, we talk about it a lot. We encourage it a lot. But it still has sort of the stigma around it where people feel like if you're asking them if they have a medical power of attorney or if they have a living will, they feel like sort of what you're saying to them is like, this is not going well. And do you have your affairs in order? And that couldn't be farther from the truth. It really is just that all humans should have them. And if you do have them, the hospital just wants a copy to make sure that we can honor your wishes. And so that we know that you're getting the kind of care you need, no matter what happens. And so even if it's just after surgery and you're still sedated, like we just want to know who to go to and what kind of decisions you would want to be made if you're not able to make them yourself. And so we realized many years ago when I was still in social work, and I think a lot of people across the hospital realized this, it was kind of an effort to change the culture and to sort of shift that perception. And that really starts with sort of education. And so it's educating patients about what it really is and just really normalizing it and validating it and saying it's really something we should all be doing. And so, don't panic and don't worry if someone asks these questions. It's something we ask literally every patient. And then it's also going to sort of the physicians and nurse practitioners and the nurses and all the people who are interacting with the patient on the clinical level and really giving them the right language to use to have these conversations in a way that is sort of still uplifting and forward thinking and not in a way that's going to scare patients. And so we really started diving into sort of a quality improvement project where we did some of these education sessions and we went across the campus and went to multiple different clinics. And through that first initial phase, what we really found is a lot of the doctors were already having these advanced care planning conversations just inherently in their day-to-day clinic visits as they would be talking about side effects or, the next treatment phase or, how they were coping. And it just ended up, they were already having the conversations, some of them. But then we realized they weren't being well documented. And so then we kind of went through this second phase of, okay, we really need a way to have a structured documentation tool to where anybody, anywhere, anytime can open a patient's chart and know what conversations have already been had, what documents do we already have on file. It should be easy. It shouldn't be something that someone has to dig around on the chart to find. And it shouldn't be something that you have to ask the patient about constantly. Like we should all be able to find it front and center. And so we sort of really went through this process with our medical record system to create that kind of documentation tool. And so we were able to see a lot of improvement. Once we had something structured that was really easy, that people could just kind of click through, select the right boxes and sign it, and it was in the patient's chart, the adherence really improved. And really advanced care planning is a quality metric and really speaks to the quality of care that patients are receiving. And so it took a few years to go through, of course, all these processes, but in the end, it was really meaningful. And, it's still something that is talked about today and just trying to continually improve those conversations and how they're happening, when they're happening, and just the documentation that they are happening.
Yeah, this actually gives me an idea. I wish it was like voice activated, because very often, just from personal experience looking in the chart, I'm looking for something and I just can't find it. It's so great if you could just call it out and the computer was like, are you looking for this? And they just like showed it all.
Yeah, you're like, yes, I am. That's exactly what I'm looking. Yes, exactly. It was, even if someone did ask a patient, hey, do you have a medical power of attorney? If the patient said yes, a lot of times it was just one line of text written, buried within this 3-page clinic note. So who's going to see that? And now the electronic record, the EHRs are getting better at searching, but that hasn't been the case up until now. And so you couldn't just search for a term and find it. And so you really did have to sort of tag it, label it, and like bring it front and center so it was easier to find.
Yeah, it actually also makes me think of how different doctor's visits would be. Be very like futuristic vibe, like, all right, Siri, I'm looking for this patient.
Yeah.
And this information, and the computer talks back like, oh, here you go. And then just like,
I don't think that's a very good idea, Dave.
I was like, we're probably actually not that far off from that, but it could be a little scary.
Yeah. So what has been the most satisfying about working with the AYA population?
Wow. Yeah. I don't even know how can I count the ways? There are just so many things that make it really satisfying. I guess maybe just sticking to the impact that can be made. And in working with all age groups, I think all of them have, their unique set of needs. Whether it's a child, it's an AYA, or it's an older adult, everybody has needs. And I wouldn't say the experience is easy for anybody. So like no matter what your age is, it can still be a really difficult, challenging experience in a lot of different ways. But I have found with the AYAs specifically that they actually seem to have a lot more, because they're kind of pulling in those the childhood issues and the adulthood issues, and then they're overlapping in this period of time. And so they're in this phase of life where they're starting to take new things on and becoming more and more independent, and like really, searching for their identity and what they want out of life. And then when cancer comes in and kind of shifts everything, it really rocks the world. And so I guess it's just really meaningful to be able to support them through that. And like, I was going to say walk with them through that, but I don't think that's actually a good term that you're supposed to use anymore. And it's not quite that. It's really just supporting them through it and sort of being a witness to it and giving them the resources, giving them the connections to each other. And when you see that magic being made, when you see those connections and those people interacting with each other saying, oh my gosh, I don't know anybody else my age that has this cancer, or you don't know anyone else who has been through this or who's had to face these things. It's just sort of like worth it to see that magic when they connect. So yeah, there's just so much good that happens. But I think that connection and support is so satisfying.
Preach.
Yeah.
This is a research area that I'm specifically interested in. And I wanted to ask if you could just maybe speak a little bit more to those areas of concerns for the populations during treatment or post-treatment.
Yeah. So, across the board, I think when you're meeting with patients, there's always questions about their housing and their transportation and their finances and just sort of their support network. And so there's all these sort of basics that you get out of the way, or not get out of the way, but the questions that you want to know about all of your patients. And I would say those are all still factors, of course, with AYAs. I think what tends to be a little bit different is really focusing on the relationships. Like this is a point in time, and not just romantic relationships, just platonic relationships. This is the time where they're dating or getting married and really sort of taking big next steps. And especially, if you're in college and you've been with this cohort for the last 3 years, and then you're the one that kind of has to take a few semesters off. Now, all of a sudden, all of your friends are like graduating and getting their first job, and like you aren't yet. And so it's those relationships that are really drastically kind of changing and just morphing and evolving in this phase of life. And so throwing cancer in there just really amplifies some of those challenges. So relationships is a really big topic. Sexual health is a really big topic. It's still something we're trying to encourage providers to talk about, patients to talk about. Like, it does impact them. And let me also just say, even 60-year-olds still, they should be asked about their sexual health too. But yeah, in these AYA ranges, like this is what all of their friends are doing. And whether they're trying to have kids or not have kids, but just talking about how to have safe sex and what that is and about their fertility risk, about their goals for family planning in the future. Like some people aren't really thinking about that yet or haven't really been asked the questions, and they don't know to ask those questions because they don't know in the ways that cancer treatment can impact that. So, just especially with sexual health, it's a big topic that we're trying to really push more. And then I think like the school and work, kind of the vocational counseling aspect of it, a lot of them still end up graduating college or they get a degree in whatever they had planned to, but there are some patients who want to switch degrees, who get cancer and realize, wait a minute, this is not what I like to do anymore, or like I want to switch, or I'm not happy and I actually want to do something that makes me happy. But even for the people who do stay the course and they do graduate, they do have their degrees and they're going on to get jobs, a lot of people who even had jobs are nervous to change those because they have their insurance. And, once you have health insurance and you're established with the medical system, the thought of changing a job or potentially losing that health insurance and potentially having to change doctors, like that's really scary. And so it's not only sort of that educational and career pathway that gets impacted, but it's even just like how to maintain a full-time job when you don't have that kind of energy anymore. And, what kind of accommodations can you ask for? How do you ask for them? What are your rights at work? All that stuff with like long-term disability and short-term disability. And they're still kind of young. And so, as people get older, sometimes there are more options, but when you're in your 20s and you haven't really paid into Social Security yet, like those aren't always options for you. So I think the relationships, the sexual health and vocational counseling are kind of the ones I would probably call it the most, with, I would add a side about mental health, but I would also say mental health is something that we focus on in all age ranges. I just think it's something now that is becoming less taboo to talk about, and people are more willing to kind of share their struggles. And so really being able to identify that and get them connected to the resources they need.
Yeah, I'd love to see a lot more mental health happen in the cancer space. I feel like that's a really important piece of the puzzle.
Yeah. Well, and so my young adults will always joke that, most hospitals have a distress screening that asks them on a scale of 1 to 10 what their distress has been in the last week. And the challenge is a lot of, especially my young adult patients, will say they always put 0, even though they'll say, oh yeah, I had an absolute meltdown yesterday, or like I had a total panic attack about my upcoming scans. But they were like, if I select this, then what? Like someone's going to call me or I'm going to hand out. Like I need like therapy. I need to talk to somebody. Like I want actual sort of mental health support. And I want to know even just like that what I'm doing is normal, or that what I'm experiencing is normal, and that I'm not alone. And so, fortunately, we have the opportunity with our patients to say, like, yes, if you select this, we will help you. We have the resources, like we got you. But it is more than just asking for a number on a scale of 1 to 10, right?
Mm-hmm. Yeah, absolutely. I also was thinking it'd be great in the medical systems. They're like, well, we see in your lab work, like your cholesterol's high or like your blood sugar's high. It'd be great if they'd be like, we could see in your lab work that your stress level's high.
I know. And then the challenge though for that is that then it's like, well, what do you do now? Because like, how do you not be stressed during cancer? Like that's hard. That's a tall order.
Yeah, absolutely. Maybe there'll be some new lab work markers that we'll be checking for in the future for mental health.
I mean, that would be the dream.
One thing that I was thinking of as I was listening to Wendy speak of just the specific concerns here for the population is there's a punk band called Grade that has a song where the lyric is, this is a time in my life where everything is falling apart, but at the same time, it's all coming together.
Yeah. And that really is, I think, what people feel like a lot of times. It's like, and there's this experience where I think from the outside, people think, okay, someone got diagnosed with cancer. It must be really hard. They're really struggling. They're getting treatment. I'd be there to support them. And then after treatment, they must be fine. And really what actually usually happens is like during treatment, they're just keeping their head down, one foot in front of the other, trying to get through it, getting to the end of it, that kind of light in the tunnel or at the end of the tunnel, like they're trying to get there. But while they're getting there, yes, everything kind of is falling apart and crumbling and changing, but they don't really have the bandwidth and the headspace to like focus on it. Like they're literally just focusing on treatment and trying to survive and having, as few symptoms as possible. But then at the end of treatment, that is when they kind of look up and realize, oh yeah, everything changed. Like all of these things are so different. It does feel like everything is falling apart. And like, it's weird because then at the same time, like now you just went through this major thing and things are actually in theory, like looking up and you're done with treatment and hopefully you've been cured. But it doesn't always feel that way. And kind of holding space for both is tough.
Yeah, absolutely. Especially just talking more on this topic about everything falling apart and, healing at the same time. I'm curious what you could tell us about the expectation that the AYA patients have for recovery and remission versus the actual recovery healing process itself.
Yeah, I actually would say that I think this is probably loosely across the board because I think this happens even when it's kids or it's older adults that get diagnosed. But I think it is that sort of experience of they expect that when they're done with treatment, everything gets better. Like their body snaps back and their life snaps back and they go back to work or they go back to school or they go back to their families and, it's done. And for some people, I do actually think it happens that way. But for a lot of people, it does not happen that way. And, I can give you a million examples, but even just thinking through of like, if you have young kids and you get through cancer and you get through the treatment and you knew it was going to be rough during those times. And so, you had people helping with drop off and pick up and meals, all that kind of stuff. But then after treatment, the expectation is that you're good again. Like everything is good. And in reality, like your body's still healing and recovering. And so sometimes like you actually still need a lot more support for many, many more months. And it's just little things like going up a flight of stairs or trying to like throw laundry in and changing it every couple hours. Like that requires energy. And sometimes people just don't have that level of energy after treatment. Sometimes their fatigue levels can take the longest to recover than anything. And some people are still experiencing pain or their wounds aren't healing or they're not eating or they're still on steroids and they're actually gaining more weight. Like they're just all of these things that don't actually happen until later or that you realize, well, I know that happened during treatment. Like I knew I gained weight from steroids during treatment, but I thought after treatment, it was all going to go away. So I just think there's this like kind of across the board expectation. And I think, sort of society keeps that in place of that once you're done with treatment, everything is good. And it's absolutely not true. And for most people, they would say that hasn't been their experience, but it's really hard to kind of educate people about that and like just bigger societal expectations of saying that sometimes after treatment is when people need the most support physically and emotionally. Like that also is when they tend to have some of the bigger mental health struggles where they realize like what this whole anxiety thing is and how even if you're 4 years out of treatment, going back to get those scans still takes you back to a deep, dark place. It still makes you feel things that you hadn't felt in the last, 6-9 months. And so it brings back a lot. And a lot of them don't have someone to talk to about that because most of the people in their lives will say, but you're fine. Don't worry. Your last scans were clean. You're not having any symptoms. You're all good. So a lot of people just will kind of not intentionally dismiss, but they want to make the patient feel better. And they just say, don't worry about it. Like not really realizing that like this is something that of course they're worried about. They're ingrained to worry about. And I've had patients even 10 years out of treatment, who are long-term survivors still have that little thread of anxiety that they didn't know when they finished treatment that they were going to still be feeling those ways 10 years later. And so I think just that's the time when people identify sort of maybe the trauma that they experienced or, new onset of anxiety, new onset panic attacks. I've even seen patients who have a little bit new onset OCD after cancer treatment. So I think there's just a lot of physical and emotional changes that happen after treatment that people just don't expect.
Mm-hmm. I'm also curious, this just raised another question, is I'm not really that aware of how much mental health is a part of this treatment process. Like after they've scored 0 on the scale, is there any follow-up like after they've recovered or they're in this recovery healing process?
Yeah. So every hospital, every clinic does it a little bit differently. And I think was like, how do you say this? I think that everyone is trying and doing what they can with the bandwidth and the resources they have, but I think everyone can be doing better. And I think everyone would probably agree that they can be doing better. I think a lot of patients come in for those follow-ups and they get those scans and, maybe someone will ask them like, how are you and how are things? But there's not as much of a focus on, okay, well, here's some resources or like, here's how we can help you. It's usually just, okay, you're good. Great. Here's your scans. You're doing fine. Just keep at it. We've even had patients who will go to their follow-up appointments and say, hey, listen, like sex is still really painful. Like, is that normal? And sometimes they're just told, yeah, it just takes time. But like a year or two already has passed. And so like it can take time, but also there's pelvic floor therapy and maybe there's some kind of hormone imbalance or, maybe there's a doctor that you could see that could evaluate things and really specifically tackle that issue. But sometimes patients aren't asked about it and sometimes they don't report it because they don't really know that could be a side effect of their cancer. So I guess that's a really long-winded way of answering the question and saying that I think people are trying and I think there's also just still so much more work to do of helping patients beyond just the end of treatment, because I think that's where a lot of the focus is.
And as a mental health professional, I wanted to throw my hat here. And what we're really talking about is the NCCN distress thermometer screening,
Mm-hmm.
and whether that is a helpful tool of having mental health screenings and ultimately referrals for that proper treatment and services. It is a requirement. I'm not sure if you know about this, Dustin, for then the Commission on Cancer to then have these certifications. So that is part of it. And it does help then screen for those who are then needing that help. But as we've discussed, maybe it's not just a one and done.
Right.
It's circling back to that and really having those conversations to then pull that thread.
Mm-hmm.
Like Wendy was saying, is to like recognize that, okay, there's a zero here, but you just said there was a meltdown. So I mean, is there some minimizing there? Absolutely.
Right.
Is there the thought that like, okay, man, am I going to get called? Am I going to then like have a service or have another appointment that it's just going to be too taxing or
Mm-hmm.
maybe just too much? But I digress. And I think for so much of that, I was really turning into like a bobblehead, like really wanting to then reflect on like that social pressure of
Mm-hmm.
the healing process. And, I've spoken to this before that like, coming out of the hospital initially, like everyone's like, oh, you're good. I'm like, well, I have a bone marrow transplant. That's
right.
And like, I'm not like, I have to have, hardcore chemo before this. And, I can't even like get up without throwing up kind of thing. So
right.
I might be home, but this is not like the end point. And really, is there an end point in this recovery process? I mean, it's going to be ongoing.
Yeah.
And for me, I mean, like I was going to also say that, it took me 3 years to go back to school. So it was probably longer than I thought it was going to take. But it was one of those things where there was a lot of perhaps barriers or, struggles that I had to then manage. And it just took that time. So,
yeah. Well, and it's hard, it's hard to know within that, the systems aren't really set up to say, okay, sure, go back to school and try it. And if you're too tired, if it doesn't work, like you can easily kind of back out. Like, can you? Yes. But like you have to pay tuition and you have to register for classes and then you have to like try it for a little while. And then in order to get out, like you don't always get your money back. So like, especially with school in that example, it's not like you can just, oh yeah, let me try to go to school and see if it works out. You kind of have to wait until like, you can do it of like, okay, X, Y, and Z is all in place. I know for sure I will be successful if I go because our systems just aren't set up for the flexibility of the in-between.
Yeah, that sounds also just discouraging for some people. I actually was one of those people where I went back to school too early because I was bored out of my mind.
Yeah.
And then the doctor's like, actually, you can't go to school for the rest of the year. And I was like, what? But I'm already registered.
Right.
And they're like, well, you're going to have to drop. So then I call university and they're like, oh, sorry, you have to finish your term.
Right.
So I just had to finish a bunch of stuff really fast. And then I was out for like the rest of the year.
You weren't able to do a medical withdrawal at that point?
We had I think 3 weeks of the term left, or maybe a month.
Okay.
And they just did some speed up of just finishing some courses. I think I did drop some, but I think I also was able to make up the final or something. Yeah, I don't know.
Yeah. And the thing is, oncologists are trained to treat cancer. So, I don't blame them for it. But someone has to tell patients about this kind of stuff. Someone has to help them walk through that sort of school process or that work process.
Yeah, I wish there was more of that.
Wendy, I was curious about the CancerWise blog. I know that that's something that MD Anderson has, and you've written several of those pieces on there. Just curious if there's any particular topic you've enjoyed writing or about.
Yeah, that's a good question. I guess all the ones I've written about, I really enjoyed. I think my favorite is always legacy work was one of the first ones I had published with them many years ago. And I think that one is still not one of my greatest accomplishments, but something I'm so glad that they saw the value in and published because, normally in oncology, no one wants to talk about legacy work because again, people always think legacy work means you're dying. And the truth is as humans, we are all dying. And so at all times, we really should be doing legacy work. And to some extent, we already are always doing a little bit of legacy work, whether we know it or not. And so, yeah, that one was amazing just to be able to sort of spread some awareness about the topic and sort of normalize it. And I felt the same way, even, about advanced care planning. I felt the same way. They've done some on how to talk to kids about cancer, which is also something I think patients have a lot of questions about. I had started a group for teens whose parents have cancer based on some curriculum that the Children's Treehouse Foundation had created called Climb. And so even that, raising a teenager is hard. And then when you throw cancer in it, it's even harder. And so, I think I appreciate the blogs just because it touches on topics that really matter to patients that come out of it. And so if I had a favorite, I guess I would say the legacy work would be the one.
Was there anything else you wanted to specifically share about what you wrote on that? I'm curious about what was the take home from the legacy write-up.
Yeah, the take home really was just that we're all doing it all the time and we should keep doing it. And it's stuff that you just don't even think about, exchanging recipes or I'll give a personal example in that my mom has always made our Thanksgiving dinner. Since I was a child, she makes it just the whole thing A to Z. Now as an adult, I realize it's a lot of work, of course. But more importantly, I realized a few years ago that I have absolutely no idea how to make any of those things. And so there will come a time where what if she was sick or what if something happened and she wasn't here anymore and she couldn't make that? We would be up a creek. We would be devastated every Thanksgiving. And so I realized I need those recipes. I need to know how to make them. I want to watch her make. And, that was 10 years ago. So my mom's still here and she's still making Thanksgiving dinner, but now we're helping, we're trying. And so that we can preserve that sort of tradition in our family. Or with Christmas ornaments. My parents have 10 boxes of Christmas ornaments, and some of them are really cherished, family heirlooms that have been in our family for generations. I have absolutely no idea which ones those are. And so I told my mom one year, I need you to take pictures of these because if something happens and I get all of your ornaments, I'm probably giving 90% of them away because I already have my own. But if I knew which ones were important, I would definitely keep doing that. And so just family traditions and, I had a friend who in their family, it was normal. It was the family tradition that you had to go to college out of state from where you grew up. They valued exploring and pushing boundaries. And so it happened with all of her aunts, uncles, cousins, everyone in her family. And so just that one little tradition, they would never have labeled that as legacy work, but that is a family tradition and it's a family value that was handed down over all these years. And so it just, the take home of the article is really just identifying that we're all doing sort of aspects of this at all times. And sometimes it's just nice to be aware of it and to actually make a conscious effort towards it, especially if you're a cancer patient and you especially want to make sure that you're remembered, and you want to make sure you're remembered in a certain way, or you want to pass things down, whether it's a tangible thing you want to pass down or it's just advice that you want to pass down. But just making that sort of step of putting some thought into it, whether it's, once a month or once a year or every so often, but just to kind of take away the sense that it's this like big, stressful, sad, horrible thing called legacy work. And like, really, it's a very, sort of attainable, ever present, always here thread running through our day-to-day lives that we're just not always recognizing.
Absolutely. I was going to share here that I recently lost my mom, and it's had that same kind of effect here where I'm really looking at, okay, well, what are some, values that I want to have carried on and still in my life, and what can be, continued on as that purpose, and that work, or life, that is.
Yeah. Well, and even like, I think in college, I was in college, and we had some task or something, or whatever the project was, the homework assignment was to ask your parents how they met. And I did it on a recording, like I tape recorded my parents. And so now I have this,
That's
although
awesome.
I'm going to have to find something I can play this on because I don't have a tape player anymore. But I actually have a recording of my parents talking in their own words with their voices about how they met. And I would have never identified that as something important. I never would have sat down with them and asked them. And I certainly would not have recorded it, had it not been for this project. But now, 15 years later, I'm so glad.
Yeah.
Their voices telling their story, documented. And like, that's a component of legacy work, and it's already done. And it's not sad to me. It's amazing. Like, I'm so happy I have it. And I know I'll only be happier as the years go on that I did it.
Hey, who would have known that they met at the library of all places, right?
Yeah. Well, and just like stories obviously like morph and tweak, and, the game of telephone and all that kind of stuff. And so it is really interesting to be able to have it in their own words.
That's a sweet story.
Yeah.
And it's nice that you have that. It makes me think about some things that I should try and collect as I get older.
Yeah, there's so many things. And even just like my dad's personality, or like, random family stories, and like, where are we capturing those stories? Where are we writing them down? Where are we recording them? And to some extent, like, iPhones have made that easier. And so now you can, it's no problem to save voicemails, and it's no problem to sort of screenshot texts and have that kind of stuff. But I think obviously the digital age has really helped our ability to preserve some of that. But yeah, it's nice to have it, because when else would you do that? It's like you never regret having it. And I even tell patients, I've had patients who have young kids, and they would say, I want to write a letter to my kids, but that just seems like I don't even know what to write. Like, how do you write a lifetime of advice in one card? And I always say, don't write a lifetime of advice in one card. You can't do it. So like, focus on a one-time story, or one piece of advice, or one thing you hope they know, or one, thing you observed about them today, and write it down on a card, and, send it to them at some point in the future, or just hold on to it until they get older. But, if you live 30 years, you will still be so glad that you wrote down those little tidbits, those little insights, those little stories about them, or something funny they did that day. Like, you will never regret having them. And so do it, do it now while you can.
Yeah.
Yeah, kids, don't squat wearing spurs.
Yeah.
Just a word of advice.
Yeah, you should write that on a card and tell them the story of how you know that. And then it will be this cherished, like, oh my gosh, can you believe my dad said this to me?
Yeah. Or don't drink an energy drink right before a workout. Very bad idea.
Yeah.
Wendy, could you tell us about the webinar series that you offered on talking to kids about cancer?
Yeah, I mentioned it a little bit earlier that I had been involved with talking to kids about cancer, obviously, kind of from the time that I was in undergrad, because I worked in pediatric oncology. So I knew how to talk to kids kind of about cancer. And then as I started working in the adult setting, I realized obviously then my patients have, some of them, young kids, and they have a lot of questions about what to say, how to say it. Like, ultimately, most parents would just say, I just don't want to mess this up. Like, I don't want to scar my kid forever. So like, no one put this in the handbook. Like, there's no parenting handbook anyway, but this definitely isn't in there. So, what do I do? And so over the years, sort of, I got more and more experience in that area, and facilitated a group for healthy kids whose parents have cancer. and created sort of a teen curriculum based off of that. And so I'd done it for many, many years. And especially now being in the AYA clinic, a lot of our patients have young kids. And so it's still a common topic. And so I presented it many times, and at CancerCon, most recently, I did one with the Bright Spot Network. But really, just to give parents the tools of what to say, and just, newsflash, you definitely should tell kids that it's cancer and you should call it cancer, and you get to define what it is for them, and, involve them in the process as much as age appropriate. So there's my one plug. But it's rewarding to be able to help parents kind of find the language of what to say and how to say it, and knowing that parents know their kids the best. So every single parent I've ever talked to, they're the expert in their kids. They know their kid the best. They're going to know how to anticipate what the reaction might be or how to handle the reaction. So that's definitely not my job to come in and tell them how their kid's going to do, but just to give them the tools of, tell me about your child. How do they usually cope? How do you usually cope? What does that look like? And then here are some of the tools to implement at home.
That's great that they're able to learn the tools that they can learn at home. I think a lot of people don't have any tools.
Yeah. I mean, parenting doesn't come with a handbook. So you never know, what to do. But we've had patients for sure who were a little nervous, and they just thought, oh, I'll just tell the kids I'm sick, or I'll just, not mention it. But kids are really, really smart and really observant, and they start noticing changes in patterns, and they start noticing things, and then their, amazing imaginations really kick into overgear, and they start kind of making up these scenarios of what they think could be wrong. And I've had parents say, well, what could be worse than cancer? And it's, well, to a 6-year-old, a monster in their closet is just as feasible as their parent dying. Anything could happen. They have these amazing magical imaginations. And so even though we may not know what they're thinking, they definitely draw their own conclusions sometimes. And so we just really advocate for, talking to the kids and not treating them like adults. You still treat them like kids, but you at least give them the words, give them the language to use, and giving those tools also to their teachers, to their aunts and uncles, to anyone who's interacting with them, so that they can also help support the child in the best way possible.
I'm reminded of a short little anecdote from a book on grief, on how there was a child's misunderstanding of what that would look like, and probably going to misremember exactly what the misconception was. I think that it's well, when are they going to be put under a rock? Yeah. Well, what does that mean? Yeah. And they were speaking to a gravestone. Yeah. So like you said, being able to have that space for an open conversation. And I'm going to have to check out that webinar. Sounds like a great series. But Wendy, wanted to thank you so much for spending time speaking about your expertise in the
gist of it. I hope everyone got some kind of takeaway from it, and thanks for having me.
Our podcast will discuss topics related to cancer treatment and the recovery process, including diagnosis, family support, resources, medications, and nutrition. We aspire to have conversations pertinent and relevant to the cancer journey.
Thank you for listening to the Sick and Good podcast. We'd like to invite you to connect with us on our social media at Instagram and Facebook accounts. We're also happy to share that we have launched the Sick and Good podcast website, sickandgood.com. This website is a place to read our bios, subscribe to the podcast, listen to full episodes, or read full transcripts, and contact us with your questions or comments. We care about your listener experience and would love to hear from you to keep the conversation going on the topics of cancer and wellness.